Hello and welcome to the Real Life Cafe. My name is Juliet. Thank you so much for joining us. We are at Emory Hospital where we are having the Emory Moms Pregnancy Fair. Moms and moms-to-be, we are all gathered here so that we can learn together in this journey of parenting. Karibuni sana.
It's a pleasure to be here. I'm glad that for the invite, first of all. Thank you, Emory Hospital. And also my expectation by the end of the day is to have a great time as it was advertised, to learn a lot and also to get to know the staff and interact with them.
I want to have a good time with other moms and have a good time. Yeah.
Your pregnancy makes you move slower, so your muscles, they ache. Tuende chini. Nani atafika? Sawa, okay. I think we can sit down. We do the next talk. So it's always important to at least confirm you're pregnant. Once you confirm you're pregnant, you come into the clinic, and then during that time we at least start you on folic acid. We also do an ultrasound, and the ultrasound is important to confirm that the pregnancy is actually inside the uterus. How many of us have heard of an ectopic pregnancy? Yeah, sometimes you can actually get pregnant, but then the pregnancy has actually gone and implanted in a different location, which is actually dangerous for the patient. So it's good to have at least your first ultrasound. It lets you know that the pregnancy is inside the uterus and the pregnancy is okay. During that time, the biggest problem of the first trimester is that you lack appetite, you're very tired, you're nauseated, you're vomiting, you're not being able to retain anything. Hauwezi, unashinda ukitapika. So unakuja hospitali, alafu kuna zile madawa unapewa. It's important to take folic. Can I mix? Okay, so it's important unapata folic because inasaidia mtoto grow vizuri. Alafu pia unapewa dawa za kuzuia kutapika. So if you're vomiting a lot, you can get dehydrated and it can actually give you clots, and then your baby is also not going to grow very well. So it's important at least kama unashinda ukitapika, not retaining anything, you come into hospital, tunakupatia dawa za kusaidia. That time you'll be coming for your clinics maybe after every 4 weeks. Daktari anakupea appointment. And the importance of coming is tunataka kuangalia kama uko na shida ya labda high blood pressure ama uko na shida ya bleeding ambayo inafanyika ukitapika. Hizo ndizo mashida daktari anataka kushinda akiangalia. Alafu pia we are measuring. Tuseme labda ulikuja clinic last time you were 12 weeks. Ukimaliza 4 weeks we expect baby pia amegrow amefikisha 16 weeks. So tunashinda tukiangalia cause huyo mtoto akona ile curve anafaa afuate. Alafu by the time now you get into the second trimester, hiyo itakuwa kutoka 14 weeks until 28. We are still monitoring the growth of the baby, and then we just checking kama leo ulikuwa 20, next visit uko 24, mtoto na pia yeye amefikisha 24. Blood pressure pia iko sawa. Kuna pia kuangalia kama sometimes watu wakiwa na wajawazito wanapata ugonjwa ya sukari. So we also monitoring things like diabetes. And then during your clinic, we are going to do some other tests. Like it's important we know your blood count. Hiyo ndio mnasikianga full hemogram. Kwa hiyo full hemogram tunaweza kujua kiwango chako cha damu, because if you have something we call anemia, yani hiyo kiwango imeshuka, it means your nutrition, hauna iron, damu yako iko chini, ni kuonesha pia hata mtoto hataweza kugrow vizuri. And sometimes unaweza pata kama unaenda kudeliver na uko na kiwango chini ya damu, you can actually also bleed. Una deliver alafu unapata mama amepata mtoto and has had a lot of bleeding after birth. So the reason you're coming to the clinic is to make sure we are preparing both the mother and the baby towards delivery. So we do the full hemogram. It's important you know your blood group. Kuna watu wengine wanakuanga na blood group iko labda kuna mtu wako A+, mwingine utasikia ako A negative. Sasa watu wa rhesus negative kuna ile matibabu wanapatanga during the clinic. It's important. Kuna zile dawa wanapata na injections wanapata ndivyo zinazuia. You know sometimes huyo mama because her is negative mwili yake haijui kurecognize mtoto wako positive. So anakuanga na complications ambazo daktari humpea dawa na ma injections to prevent those complications. Pia we also screen for HIV, we also screen for a virus called hepatitis na ingine inaitwa syphilis. The reason why these three are important are the three viruses that if a mother is sick, your baby can also get that from you. So it's important, like if we find someone maybe is HIV positive, we have to make sure she started on treatment so that as he transmits your virus from herself to her baby. Hata hepatitis, we also check that, na hata syphilis. Like now, kitambo, syphilis siku hizi haiko, but kitambo sasa ilikuwa, if a baby gets, unapata nazaliwa, macho iko red, amepata infection, then that eye actually gets destroyed. So it's very important for those diseases to be found early, before the mother transmits them to the baby. Then we also check your sugar, like I said, and then your urine. Urine inatusaidia because tutajua kama uko na infection ama uko na, kwa hiyo mkojo tutaweza kuona kama iko na sukari. Sasa watu wale wako na ugonjwa ya sukari pia itaonekana kwa mkojo. Na tuseme kama mtu ako na high blood pressure pia tutaweza kujua kwa mkojo. So it's important tunafanya hizo test zote. So and then during the second trimester kuna injections mbili mtu upata. Kwa mimba ya kwanza utapata tetanus, 2 tetanus injections. 1 dose alafu ingine utapata after 4 weeks. But then in your other pregnancies you'll just be getting 1 dose, 1 dose, 1 dose. So that is usually hiyo ndio kazi ya second trimester. Alafu utapata saa hiyo at least appetite iko, you're feeling better, you're not nauseated, you're being able to go to work as you're now coming towards third trimester. So tumefikisha 28 weeks. Now third trimester, the biggest thing that's happening in third trimester is that your baby has to now grow in size. Unaona umefikisha kutoka 0 mpaka 28. Up till there, the baby is only 1 kg. Hata tukikupima tunakupeanga scan imeandika hapo 600 grams. Kaki kitu kadogo kama blue band, you see? Not very heavy. But you can imagine now from 28 weeks, you have reached 1 kg and sometimes by the time you are delivering, mtoto anatoka akiwa na 4. Si ndio? Kuna mtu anayepata mtoto mkubwa hivyo. Wako wapi? So you're going to find third trimester mainly is for the baby now to grow in size and then also the organs zikuwe mature. Tuseme sasa akizaliwa hata ataweza kupumua, ukimpea maziwa ataweza kudigest vizuri bila kupata shida, ataweza kuenda choo, basically to mature those organs so that now the baby is able to survive outside now once you deliver, because the baby usually is just surviving here. You're the one who is eating for the baby, breathing for the baby, doing everything for the baby. So basically third trimester is for that. Then there are usually things we usually ask you to do a lot. When you're pregnant, it's important, there are things we call danger signs. And it's important to always remember them from 0 up to the end, because they're the first sign that maybe something is going wrong and you need treatment. So immediately you start experiencing those things, it's important you come to the clinic, you tell the doctor, ama if you're at home you make sure you come. Naonanga saa zingine watu wako kwa Facebook wanauliza niko na headache. I'm like, you have a headache. Unafaa ukue hata umetoka kwa nyumba huko, unaulizia hiyo swali ukiwa kuja nimuulize maswali hapa. Don't postpone some of those alafu unafika hospitali saa zile uko na complications, ndio? So the major complications, if you have a very severe headache, umeuma na kichwa, Ukaamka watu wanakuambia umefura uso ama umefura mikono excessive, upate miguu pia imefura, hiyo nafaa hata utoke, don't even think, uvae nguo, tupatane wapi? Hospitali if you have that. Any time in pregnancy ukijipata kuna damu yoyote inatoka unless ni ile spotting ya labor but when you're pregnant, if you find you're bleeding or you have severe, yani uchungu ya tumbo iko very very painful usiulize mtu swali, what you do? Hospital, yeah. Don't stay at home with some of those signs. And then of course some of the times you start unaanzanga kusikia movements za mtoto ukiwa hapo 26 28 weeks. So once you start feeling the movements of the baby, the movements of the baby should be continuous throughout until even the day you deliver. Even when you're in labor, by the way, you still feel those movements. So anytime una doubt, mtoto wangu alikuanga anacheza na leo nasikia kama hachezi, afadhali ukuje hospitali aangaliwe. So the baby's movements. So severe headaches, excessive swelling of your face, hands and legs. If you have severe abdominal pain, if you have any bleeding in pregnancy, you should come to hospital. Or if you have any reduced, we call them reduced fetal movements. Mtoto wako alikuwa anacheza, alafu sasa unasikia kama inaenda ikipungua, ukuje uangaliwe mapema. So usually those are the things we do in the clinic. Then of course sasa third trimester ukikaribia, sasa unaona ile date tunawapeanga, tunawaambianga mtazaa plus or minus 2 weeks around there. So 38 weeks, 39 weeks, 40 weeks. You're supposed to have started having what we call a birth plan. Ushachagua hospitali, unajua wanalipisha aje, unajua hiyo maternity ushaingia umeiona, si ndio? It's a birth plan. You have actually prepared. Unajua ile siku utapata labor ni nani atakuleta hospitali. Mnakwanga mmepanga hivyo? The men. Si ndio? Si ati you're in labor unangoja mtu ako town. At least mkuwe na plan A and plan B because it can be an emergency. So all the time when you're pregnant, always have a plan A and a plan B. There is someone you can call to come and assist you. Then by that time, towards delivery, we prepare you for labor. We discuss sasa ukiwa labor signs zinakuanga 3. Either you start having cramps which are down here, si ndio? Alafu kuna mtu aliniambia, patient aliniambia anasikia ikiwa circle. Hiyo pain inaanzanga hapa inaenda hivi. It's like a circle from the here in front. That's what the patient told me. Aliniambia hiyo uchungu yangu inaenda kama circle. Lower abdominal pain and ina radiate to the back. Or sometimes you have the water, hiyo maji ya mtoto unaona imeanza kuvuja. So it's leaking, it comes out ikiwa clear. Inaweza toka a bit ama itoke ikiwa mingi kama like a tap. You know you can open a tap kidogo kidogo. So ama ufungue kabisa unapata hiyo maji yote imetoka. Wewe usiulize swali kwa Facebook ujipate wapi? Hospitali, please. And then the other one we have is spotting. Unaweza pata discharge kama makamasi ikiwa na damu, what we call show. It's like mucus, like when your period is starting, not bleeding, not at pouring. If you're pouring blood, you're supposed to get out of your house quickly and come to the hospital. The one for labor doesn't pour, ni tu discharge imeanza ikiwa na damu because cervix sasa imeanza kufunguka. So you also come to hospital and then you'll be admitted. Lakini now depending on what, not every mother is the same and you'll have been coming to the clinic. So depending on what your issue is, kama kuna wale wanazaa na CS wanakuanga washajua mapema na wameelezewa na daktari, if there is a complication you need a cesarean section. But most of the time the normal labor is the best. If your normal labor can progress well and you end up with a normal labor, it is usually simple for the mother and the mother recovers very well. But of course if there is an issue and you need a cesarean section, no problem, as long as the mother and the baby are fine after delivery. I'm okay, yeah? So before we go to discuss the nutrition, maybe I can take a few questions. Kitumeona kama nimesahau. And it's always the antenatal book. Always carry that book in your handbag, yeah? Because that's a book we communicate with amongst the hospitals. Wherever you are, your book ukitoa, whichever doctor you give, they are able to understand whatever we have written in that book. So you should always have your antenatal book with you when you're pregnant. Na pia sasa wakianza shule wataanza kukuitisha hiyo book because of the vaccinations at the back. So usipoteze. Labor signs, yeah.
Mine is, I don't know whether it's a new one. Because when I got my second call, I didn't see the food. I vomited.
Oh, okay.
So after vomiting, I left the house as if I was going for a normal treatment. That's when I was told you are on labor.
You're in labor. So most likely you started vomiting because of the, unajua when the contractions start, kuna zile hormones ina release ndio zilifanya sasa ukatapika. But usually the 3 ni hizo. Yeah. Silent labor. So sometimes you can be having contractions and you're not feeling. Unaweza kuja hapa tukupime hata tukuambie by the way hata ushafikisha 3 centimeters or 4 centimeters. But that can only happen very early stages of labor. By the time you're pushing the baby, it can no longer be silent because contractions lazima zikuwe mild. So maybe you're having mild contractions which you're not really feeling. But you know, labor progresses from mild, then they become moderate, and then they become strong. By the time they are strong, you will feel them because you need to have enough force to push the baby out. Yeah. So sometimes on this side sazile, depending on how the patient is perceiving, akiwa hii side ya mild contractions hata hazisikii. But zikianza kukua moderate na strong, you will start feeling the pain because labor pain is actually, it's painful. Yes. Okay. Okay. I'll say yes, and she's asked, ameuliza, nimesema normal labor, si ndio? Is there abnormal labor? Okay, so first, there are 2 ways of delivery. Delivery through pushing without a surgery, and then we have sometimes you deliver through an operation, a cesarean section. But now when it comes to normal labor is the one, kuna chart tunatumia, that you started maybe at 4 centimeters, na expect uta take 6 hours to deliver. Then, but when I come and check you after 6 hours, bado uko 4 centimeters. So unaona hiyo labor yako haiendelei vile inafaa kuendelea, because at least every hour you're dilating 1 centimeter na mtoto anashuka. So sometimes the labor, we can say, okay, we don't call it abnormal labor, but we just say maybe there is poor progress. Because sometimes you can find labda that mother has a baby who is so big, ako 4 kg, hata ukimweka hapo the whole day, mtoto hata shuka na hata toka kwa njia ya uzazi. Yeah. Any questions? Yes, I would say yes, because you're going to find, you know, mtoto anaweza kuwa lean na side moja. Kwa hivyo uzito yake yote labda inakupress hizi nerves za hii side ama the blood vessel. So hata wewe mwenyewe utasikia kuna mguu moja unasikia kama ndio imeganda, but hii mguu ingine hauigandi because all the weight ni vile tu mtoto amelala ama kichwa ya mtoto imekupress more on that side. So it happens. Utapata mtu anasikia uchungu sana side moja. False labor can come, you have a contraction for 30 seconds na iishe. So the difference between, so you're going to ask me, is there false, is there true labor? So false labor is a contraction that you have, ni zile unasikianga Braxton Hicks, you have heard of that term? It just comes, you have a contraction, it's like a muscle pull on the uterus, alafu inaenda. Ina last a few seconds and then it will go. But hautapata ingine. And they come most of the time to tuseme 34 weeks, ama 36. Sometimes the baby moves, you feel pain. But now it will not open the cervix na mtoto hatatoka. But true labor, once you start experiencing true labor, the contractions will continue. Hazita stop. Utapata contraction moja. After another few minutes, 10 minutes, you'll get another one. After another 10 minutes, you'll get another one. And eventually, ukikuja hapa, hata tutapata cervix imefunguka na mtoto ashaanza kuteremka. So that is now what is the true labor. Yes.
When you talk of cord formation, so in that case, you go for CS or
So it depends. If I come, I find maybe you came at 4 centimeters, but you are having just no contractions. Alafu after 4 hours, I come and find your 4 centimeters. So you see, that already tells me maybe what is the problem is you don't have enough contractions. So if you find the contractions are mild, kuna ile dawa tunaweza kukuweka to at least increase your contractions. But now, if you are having very, very strong contractions and you're stuck, because strong contractions should make you deliver. So if you're having strong contractions, you're 4 centimeters, I come after 4 hours, you're having very strong contractions and the cervix is not opening, then it already means there's something, there's an issue. So most likely you will end up delivering CS because your labor is not progressing, even if you're having strong contractions. Yeah. Kuna swali? Supplements. Okay. So usually we'll start you, I said before even getting pregnant, if you're able to plan, one of the best supplements to start is folic. Folic acid. There's someone who will be talking about the quantities. It's usually 400 micrograms. There's a dose which is recommended by the World Health Organization. So you start it because it helps in terms of development of the baby, even before you get pregnant. Then once you get pregnant, that is the supplement which is used in the first trimester, because first trimester is when the baby is developing. Then after that, we usually will give you the supplements like iron, because mothers who are pregnant, remember we said we don't want you to have anemia. Anemia is your blood. Basically, it's what you need in your body. If it is low, that means even your baby will not be getting enough oxygen and your baby is also not going to grow. So you can end up with what we call growth retardation. Napima mtoto uko supposed kukua 36 weeks, napata mtoto ako 32, kadogo. Kanazaliwa maybe 1.2, yet you're expecting the baby to be 2 kg. So it prevents the baby from growing if you're having anemia. Another issue is also calcium. Calcium is important to supplement because from about 32 weeks until when you deliver is when the bones, mahede, I can say in Kikuyu, yes, is when the skeletal system, the bones, just develop, especially third trimester. So we usually give supplements like that. And then maybe for someone who also has another problem with their nutrition, you supplement. Because pregnancy is a journey. Hutaki umalize 40 weeks, you're trying to make sure the journey completes how? Successfully, yeah. And of course, always encouraging you to make sure you're having a balanced diet and enough fluids during pregnancy. But there is someone who's going to do something about nutrition. Range. Okay, so usually when you're not pregnant, for women, we expect you to, at least if you have a HB of 12 and above, you're fine, 12 and 14. You're going to find men, because men, they don't get periods, they don't lose any blood. So for them, they are just eating, they are having iron, they are eating liver, they are eating meat, then they are retaining their iron and only losing maybe very small amounts. You find the men are from 14 and 16. Now for women, because we have periods and we are losing blood every month, our normal range is 12 to 14. But because pregnancy changes your body, you add water, you retain water, ni kama dilute juice. But even if it dilutes, you're only allowed at least between 10 and 12, yeah? If you start finding yourself 9 point something, 8, 7, that is not good for pregnancy. We either have to give you supplements or for some people, like if you come at 5, a patient who comes with a HP of 5, you may have to give her even blood, you transfuse, So it depends on what you're having. But anything below 10 is not advisable in pregnancy, yeah. Severe back pain. Are you having pain, my dear? Are you okay? It can be the weight. And pregnancy also changes the curve of your back. So that can cause you to have backache. But if the pain is severe, then it needs to be checked. Yeah. But you're also going to be having what we call pelvic pressure. Unajua sasa, mtoto amefikisha hata labda 3 kg. Sasa umekaliwa hapa na 3 kgs. Utakuwa ukisikia hapa ni pa zito, but haifai kukua very severe. Or maybe some of the ligaments are also becoming loose. Yeah. Okay, a good question. There are some birth defects which can be prevented. We say like something like what we call spina bifida. You find sometimes the baby's back can have a problem. Some of those are prevented by use of folic acid. Autism, unfortunately, people do not really understand the exact cause of what causes autism. And so there's nothing that specific that you can say that will prevent autism. But remember, getting pregnant is genetics, sindio. So sometimes that process, the most you can do is you avoid things that can make the process abnormal. So things like alcohol, it's always good to avoid. As long as you're pregnant or planning to be pregnant, avoid toxins. Avoid things like smoking, avoid alcohol, avoid nowadays even sometimes drugs, yeah? So as long as you're planning to get pregnant, just try and maintain a very healthy lifestyle. But now, unfortunately, some things are not preventable. And then sometimes for some people, you have higher risk. Like now, for women who get maybe pregnant in their 40s, it is high risk that their baby may develop Down syndrome. But it's not everyone, you see. So some things you can't completely prevent, yeah. You only discover now after the baby has already been born, and then is when you will discover some defects. But some defects are discovered, like physical ones, if there's a problem with the back or the problem with the head. That's why we always do a scan at 20 weeks, what we call an anomaly scan, looking for abnormalities. So the physical ones may be seen, but some other things in terms of like retardation, you can't pick on a scan. Yeah. Oh, nini nasababisha placenta ikuwe chini? Hiyo huwezi determine. The placenta, once you get pregnant, the pregnancy comes into the uterus, pale itajipanda ndio tutaipata. Hiyo hauwezi determine. You can get headaches, yes. Tuseme labda hujalala vizuri, umeshinda kwa jua the whole day, hujakula, you're dehydrated, you can get headaches. But we said if the headaches are severe, as in haziendi, inafaa uende hospitali wakupime blood pressure.
Thank you that you came and to have a good time. Sawa. To have 2 simple moves so that all of us we can tukue kwa hiyo mood. Ni sawa sawa. Hata wenye wameketi bado, hata kama tumeketi bado tukue in the mood, si ndio?
Nani anakuja kusupport?
Wenye anakuja person. There's a lady who was here before. Come right here. And anyone else who feels they can do this, hata kama tukuje tu video hii tunafanya tu simple zenye tutacoordinate sisi wote. Well, join us.
Watapata kitu.
Well, good.
Nipate zawadi.
Anyone else? DJ tuanzishie. Anyone else?
Tunaangalia
Good. Anyone else? Now tuanze. Everybody, we go. We change the other leg. Smiling faces. Like this. Make sure your baby is dancing too. Let's all dance. The other hand. We dance with our babies too. Nice one. Smiling faces always. Waist kidogo. kidogo. Another one. Move in front, backwards, and smile. Let's hug our babies. Another side, Mama. Let's turn around. Turn around. Turn around again.
Ukilala right, unasikia uchungu na turn left.
No, no.